Hi, my name is Dory Cleesis with Mount Sinai. I'm with Dr. Bruce Darrow, a cardiologist at Mount Sinai and Chief Medical Informations Officer. Thanks for joining us.
Thank you, Dory.
So tell us about how technology is changing the way we care for patients.
So when I think about the use of technology in healthcare today, I really divide it into two categories. On the one hand, there's a lot of blocking and tackling that's still going on just to make sure that clinicians have the right tools that they need to be able to take care of patients, to share that information with patients, to give the ability of different health systems to move information from one to the other, and very basic things that you would want out of technology.
And it's moving it to where the patients are these days, not just in the hospital.
Exactly. So it's moving it from just in the hospital to the ambulatory setting into the patient's home. And to that point, there's also that second component, which is to use tools of technology to do things that we could never do before. So for example, it used to be that if you wanted to see the doctor, you had to come see the doctor. You had to come to the office, you had to go to an emergency room, urgent care, or be hospitalized. But now a lot of that care can appropriately be pushed into the patient's home or another setting where it's easier for that patient to feel like they have access to care using technology tools.
So one example is Hospital at Home that Mount Sinai supports. What's your role in helping them with technology?
So my role with Hospital at Home, as it is with most of the clinicians at Mount Sinai, is to make sure that they have the right tools to do what they need, and they get to define that. So for Hospital at Home, it means the ability to do video visits and check-in, to be able to use monitoring tools so that the patients can do things like check their blood pressure or their heart rhythm or their weight at home and give that information to their care team so that the care team has what they need to be able to do to take care of that patient there.
So Mount Sinai has expanded over 300 locations. We have a growing ambulatory network. How is technology helping patients in those areas?
So through a combination of things, part of it is just the ability to see their own information, to know that they can get their own laboratory results very easily, that they can see what their doctor wrote about them and take that information with them wherever they happen to be. And then to start tapping into some of those newer abilities, the ability to do monitoring at home, the ability to check their heart rhythm, the ability to use apps to monitor their eating, monitor their symptoms for conditions like inflammatory bowel disease.
They're more in control, they know more of the information, and it gets to the doctor sort of on its own.
Exactly, and it's very empowering for patients, and to a certain extent it's good for the clinicians too, because it allows the doctors to let the patients do the jobs that they would want to do themselves, rather than a doctor sitting down and saying, how are you feeling today? How did you feel yesterday? What did you eat yesterday? The patient can do that on their own, in their own time, in their own setting, and the doctor just can collect and work with that information.
Terrific, and we're hearing a lot now about artificial intelligence and healthcare. Do you think that that plays a role in healthcare of the future?
Absolutely. I think that artificial intelligence is going to be essential when we are thinking about the way to do the work of taking care of patients at a population level, especially more effectively. If I'm a primary care doctor who's taking care of 2,500 patients, only 20 or 30 of those patients will come into my office on any given day, but at the same time there are several of them at home who may be at risk. Rather than combing through that entire list of 2,500 patients, if I have tools to suggest, based on the prior history of those patients and what we know about them and the information that comes in, I can then say, okay, this week it's important for me or somebody on my care team to call these 100 patients and check in and make sure they're okay, and if necessary, bring them into the office so we can have a discussion.
Everyone is thinking about electronic medical records, and a question that comes up is, why don't they all communicate? What can we do to help patients be armed with their information and have the systems talk to each other?
Electronic medical records have been challenging to connect to one another because of the way they were born. They were born out of decisions not to generate a national patient identity that would allow the same patient to be identified as such from one system to another. And there was no original standard for what the medical records would do and how they would interoperate with each other. The government and the industry have recognized that problem, and that is where the work of the next 3 years will be.
So we're making some progress.
Absolutely. And at this point, I have patients who come in to see me in the office, and I can pull their information from a number of systems throughout the New York area as well as nationwide.
Terrific. And I want to mention that Mount Sinai has telemedicine services. So
Absolutely.
when are we going to roll that out officially and formally, or are we already?
We already have telemedicine services live, whether it's patients who can have their follow-up visit with their doctor through a video visit, whether it's the ability to get an on-demand video visit with one of our emergency trained doctors, whether it's the ability of one doctor to do a virtual communication to a specialist, or excuse me, or for us to bring a specialist like a stroke expert in to participate in the care of a patient in an emergency department. We can do all that by video today.
Terrific. And any resources you want to share? Is it in terms of video visits at Mount Sinai?
Just go to our website.
Wonderful. MountSinai.org. Thank you very much.